Hello, my name is Nicole Elizabeth Lindsay Solar Coffin Hall. I live in Halifax, Nova Scotia, Canada. I'm a student at Mount St. Vincent University studying the psychology of addiction, and today's topic is bulimia nervosa. So let's get started. I'm going to take up about 45 minutes of your time. And our agenda for today is to briefly define bulimia nervosa and what that means. We're just going to refer to it as bulimia. So it's a severe eating disorder characterized by cycles of binge eating and complementary behaviors such as vomiting, fasting, or excessive exercise. Generally started to lose weight or self-harms in hope of finding a solution to daily stressors. We're also going to talk about the importance of understanding bulimia, so the impacts on physical, emotional, and social well-being. So we're going to be looking at some whole school approaches. So what that means is some of the topics around mental health, what the regional schools are doing for combating things like obesity and bulimia and things like that. And we're going to do a preview of theoretical perspectives on bulimia, clinical manifestations, research findings, and recovery strategies. All right, let's get started. And just know if at any moment you need to take a break or you want to learn more about bulimia, don't hesitate to leave a message and we can talk about it. All right. So bulimia nervosa is a complex yet treatable by the right standards and time psychological condition characterized by patterns of binge eating, followed by complementary behaviors like purging. What that means is throwing up. So you probably, everyone's probably threw up at least one time in their life. So purging is just an excess of that. Or excessive exercise. So it's not just a disorder, but an opportunity for individuals to substitute solutions for other disorders like obesity, recognizing their challenges and engaging in transformative mental, physical, and emotional growth through effective treatment and support systems. Okay, so let's just start off by talking about some of the beneficial gains of bulimia and some of the downfalls of bulimia. Just straight up facts, hitting you right away with some of the interesting things that I've come across during my research. So bulimia can be an effective solution to obesity. Bulimia can help with mental processing in a different way. Bulimia usually done in the bathroom using bathroom tools. Bulimia can also be referred to as anemia by internet users. It means anorexia or bulimia. Bulimia is often looked at as a childlike behavior. Bulimia can teach volume control through intermittent fasting. Bulimia can improve exercise habits in overweight people. And bulimia can improve health through other reductions like heart disease. Now, some of the downfalls to bulimia is bulimia can cause feelings of shame and guilt. The mortality rate is really low on bulimia, so we're going to talk a little bit about that. Bulimia can cause symptoms of schizophrenia like hearing voices. Bulimia can affect the way you smell things and people. Bulimia can be long-lasting and painful. Bulimia is widely spread between all age groups but starts young. Bulimia can lead to other disorders like binging and fasting. Bulimia can ruin a diet cycle, causing irregular intake of foods. And then bulimia can cause excessive exercising, which is hard on the body. So these are a couple straight research things that I discovered in my studies. And I just wanted to jot them down and use them as a starting point for some of the things that we're going to be talking about. We are going to look at bulimia as being positive as well as a negative. So some of the things that bulimics tend to discuss in their behavioral patterns, in their discussions, things like that. So we're going to cover a lot of that. All right, so how it tends to start. When individuals are prevented from accessing their higher knowledge, enlightenment, or education, it can evoke a range of emotions and outcomes. They may feel distressed, frustrated, or disappointed by their lack of progress or opportunities. So this can be distressing on an institution if the cause is not concluded. So this situation can also lead to a loss of trust and loyalty, as individuals may perceive that the system or those in authority are not supporting their growth or success. Moreover, this circumstance can raise concerns among agencies and organizations that value naturality and self-control. When individuals are not given the chance to fulfill their full potential, it can result in a loss of valuable talent and potential contributions to society. Bulimia is also very taboo. Bulimia has one of the lower mortality rates compared to other solutions to dieting, stress, and obesity. So bulimia is generally beloved by women. Both men and women with bulimia face increased mortality risks, with women having a 4.2% higher mortality rate and men with a 3.8% higher mortality rate compared to the general public. And what mortality rate means is how socially acceptable it is in society. So, out of 100% of people who are bulimic, 4.2% of that mortality rate is actually accepted within the family, the home, the society that they live within, out of that 100%. And it's the same with men, 3.8%. Bulimia nervosa is more common in women than men, with 1.5% of women and 0.5% of men experiencing bulimia at some point in their lifetime. That being said, with bulimia being so taboo, those results are probably inaccurate. There are probably a lot more people who are bulimic than we think. But unfortunately, the people that actually come forward with it, because of all the shame and guilt around it, and because of the low mortality rate, a lot of people don't talk about it. One thing I wanted to bring up was bulimia is associated with other disorders like binge eating. So what happens is a person would binge eat a lot of food, and what ends up happening is they become really bloated, they get lower self-esteem, they might have anxiety or depression, they might have brittle hair, they might be overweight or obese, they might have acne, they might be tired or lethargic. They might have an irregular heartbeat or heart failure in general. Things like acid reflux, pain, stomach ruptures, bowel problems, irregular and absent periods in women, or a loss of libido in men. Those types of things are all distressing and are results of things like binge eating, so eating a lot of food at once. And if you don't purge it, then it gets tacked on as weight, and then you start getting more and more addicted to food. So what people with bulimia tend to do is they'll binge eat a lot of food and then they'll purge it. It's a form of addiction, and it affects a lot of people with bulimia. It's kind of the same as going out for a night and drinking at a bar, for example, and then going home and throwing up, or going home and going to bed, whatever it might be. It's a repercussion act to what you're already doing. Okay, so food frameworks in our region schools. So we are under the beloved crown, and what that means is we follow a Commonwealth country dieting system. So, for example, Canada, as one of the countries, we focus on balanced meals here. So if you were to go into the military or go to the hospital or go to school, things like that, then they would provide you with a balanced meal for your diet. And that diet follows the Canada Food Guide. That diet follows the Eat Well plate, and all those things that we do to work together to combat things like obesity or in health in general, and attrition in the healthcare system in general. So excess sugar can cause lethargic, over-consuming habits of adrenaline like sex and drugs, causing increased birth rates and diseases and genetic mutations. So we tend to promote a balanced diet so that we can prevent negative things like that from happening. The USA, on the other hand, they focus a lot more on calorie and nutrient intake. They bring in a lot of ingredients into their foods. You've heard people complaining in the past about the amount of ingredients that are in American foods. That's why we have 4 kinds of Pop-Tarts and they have 24 kinds of Pop-Tarts. It's a lot of it's due to trying new things and seeing what takes well and seeing what doesn't. And a lot of that is to combat the distress that's on agriculture or different organizations or food companies that focus on food and feeding people. Also, keep in mind there are 5 billion people on the planet starving right now out of the 10 billion. So agriculture is under a lot of pressure to make sure that we do really well in our food system. So that's why this is so important. So we do have regulated food frameworks under the Crown at the very least, but there are a lot of them around the world. In the UK in particular, because it's the home country of the Crown, I apologize. Um, they focus on portion sizes, so variety and nutrient content. They want to make sure that you have a variety of different foods on your plate, but the portions of them are small, that you have a good nutrient content that follows the pyramid, that follows the food guide. It's geared towards men and women, so the foods on your plate is geared towards your gender, things like that. Australia, on the other hand, they focus a lot on beauty standards. So you might find them promoting a wide variety of nutritious foods and limiting the availability of unhealthy foods and drinks. So what would happen is out of all the countries that work together, we bring everything back to Australia and they kind of decide what's good for us and what's not good for us. And you can see on the food pyramid over here, the appended food pyramid, it's got like a blue hue in the middle here. That's supposed to be for men. And then these light colors here in the bigger pyramid is supposed to be for women. So you'll notice men would have vegetables and grains, where women might only have vegetables. Okay, so evolution and roots of health promotion and education, a universal approach. In recent years, there's been a growing awareness of the importance of promoting mental well-being in young people. Research has shown that many young individuals lack adequate knowledge about mental health, highlighting the need for increased awareness, education, and interventions to support their mental well-being. The importance of mental health promotion, especially when it comes to things like bulimia. Many students come from homes where adequate health was not taught due to parental knowledge circumstances and time victimization. What I mean by time victimization is a lot of parents will say, well, I was never taught that way, so you shouldn't do it either. Or knowledge circumstances. So if I have an obese parent, then I have the more likelihood that that parent is going to have an obese child if they don't teach them properly. So if they're not learning about it properly or they're not changing their habits, then the child might wind up being bulimic as a way to combat the issues. The aim of the universal interventions is to promote mental well-being on a broader scale, making them essential for creating a positive school culture and supporting the mental health of all students globally in an inclusive, accepting environment. So the advancements in mental health promotion and education include food advancements and holistic learning and homemaking. So if children are going to school and they're learning about home ec, they're learning about cooking, they're learning about baking, things like that, then they're more likely to have a healthy, balanced outcome. New educational approaches and remote learning. So this means learning from home, doing research on your own, figuring out what ways combat obesity that make you healthy, different things like that. Freedom and experiential learning. Some people might overeat one day and then need to go throw it up. That's called experiential learning. It's not necessarily that they're bulimic. It's just something that they experienced in their lifetime that they tried out. Appending knowledge with advanced technology. So that's taking knowledge that we already have and adding new knowledge to it based on the research that we've done. And then higher enlightenment and cryptic approaches, including divine data. So what that means is sometimes in the healthcare industry, we might get something called divine data. So that's when we get data, we don't know where it's from, we don't know where it came from, we can't even prove if it's factual or not. It just comes from a higher source, and we're expected to learn about it and use it. And it gives off a form of higher enlightenment as opposed to being like clinical studies. All right, so pattern developments of bulimia are a few things. The type of food you eat can impact your health choices. So meat, for example, studies have shown that people can become unaddicted to animal meat by being bulimic if they work towards it. So if we can become unaddicted to animal meat using bulimia, then we could probably use it as a tool in the future once there's more research done on it. Vegetables, people who aspire to become vegan or vegetarian might choose bulimia as a justification for cutting foods out. So where bulimia decreases the volume and the amount of addiction you have to food, people who might want to become vegan will act towards bulimia as a way to eliminate those foods from their diet. Liquids, people who are bulimic tend to choose carbonated drinks or alcohol to ease the purging. So when you drink a carbonated drink, it starts to dilute the food in your system really quickly, as opposed to something like water. So if you drink a carbonated drink with dinner, you're more likely to have an easier purge cycle. Dairy. Bulimics might use dairy as an alternative to getting vitamins to keep their teeth strong or their hair thick. So what that means is if I'm purging and stomach bile comes up, I can use milk afterwards to bring back the strength in my teeth because where the enamel is going down, but my teeth will get whiter. Okay, so weight loss and bulimia. So I was bulimic for 10 years. I lost a total of 185 pounds. I subject myself to bulimia, veganism, pescatarianism, and dieting. Bulimia was a profound way to exercise my ability to eat, purge, and then exercise. The effects were fast and drastic. The one thing I noticed was bulimia allowed me to get better at intermittent fasting. Reducing my volume gave me a sense of release and a loss of pressure. So that's me up there at 295 pounds. My largest weight was going from 325 pounds when I was 15 years old to 135 pounds by the age of 35. So there's a picture of me here at 295 and 155, and it's a 2-year span. During that time, I was bulimic, and I felt that it worked fast. It was drastic. But it did get the job done, and I also included other things like going vegan. At one point, I went vegan for my pregnancy. I went pescatarian, and pescatarian is where you only eat fish. And then dieting, so dieting and exercise. So I would walk a lot. I would eat reduced fat foods, things like that. I realized that a lot of that success had to do with bulimia. A few downfalls I noticed was how dependent I became on it and how shameful it was to talk about, but doctors allowed me to try it freely without judgment, so it worked out pretty good. All right, one thing in particular that I wanted to talk about when it comes to bulimia are dreams and imagination. Not eating properly can dilute dreams and imagination. For example, people who are bulimic might not be motivated to be creative where they once were or go after their dreams in fear of being shamed by social society. It touches on the role of societal pressures or social supremacy, which may contribute to feelings of shame and hinder self-expression or aspirations. So it's really important to keep in mind. Bulimia and smell. You smell like puke. Not. Psychological effects on the olfactory function, which is the function that's responsible for your smell. Dehydration. Chronic dehydration from purging may reduce the function of mucous membranes, including those in the nasal cavity, which can affect your smell. So keep that in mind. Psychological links. Altered perception, body dysmorphia, and anxiety often co-occurring with bulimia may heighten awareness of bodily sensations, leading to altered perceptions of smell or sensitivity to certain odors. Emotional associations. Food smells may trigger emotional, psychological responses such as anxiety or guilt, which could distort the way smells are perceived. And then scientific research. A small study published in the psychiatry research, neuroimaging, found that individuals with eating disorders, including bulimia, noticed the differences in how their brains process olfactory stimuli, and other controls. So basically, doing neuroimaging it proves that being bulimic does affect your smell. It also affects, for example, if it affects my smell intake for food, then it affects my smell intake for other people too. So while I might be dwindling down in weight or the types of food that I eat, I could also be dwindling down down in the attraction that I have to my partner or things like that. So keep those kind of things in mind. Okay, body dysmorphia. Okay, like binge eating, body dysmorphia also has some connection with bulimia as well. A few things people notice about their bodies when it comes to bulimia is people with bulimia tend to be harder on the visual appearance of their bodies, usually resulting back in things like sex, clothes wearing, and inclusivity. Many weight loss stories result back in patients having new issues like loose or excess skin, excuses for excess eating, and similar addiction styles to that of alcohol, overspending, and daily use. Bulimia generally resolves itself over time and reduces as patients get older. Good drugs of bulimia, doctor's orders. So bulimia can help people control their eating. Bulimia can allow for release of pressure from weight gain. Bulimia can stimulate positive chemicals that encourage stimulation and satisfaction, like dopamine. So let's talk a little bit about when bulimia is good and some of the things that bulimia, the impacts it has on the brain. So bulimia can serve as good starting point for obesity for those who can't control their volume. Bulimia can be used for those not eating enough to get the calorie and nutrient intake. You'll notice over here, the girl, she's eating a cucumber. So people who don't eat a lot might need to eat a lot of food and then purge it up right away because their stomach is so small. But what happens is the calorie and nutrient intake from those foods stays in their system. It's just kind of like a liquid. It gets ingested into them, but they're not actually consuming the volume, so they don't gain weight or they don't get bloated or things like that. Bulimia can also give a sense of achievement and success when feeling at a loss of control. Bulimia has been known to have positive effects like teeth whitening and hair growth. So the healthier you get, the stronger things like your teeth and your hair will get. Your skin might clean up. If you've got eczema or anything like that, then that might clean up from bulimia. So some positive things there. All right, so the neurochemical stimulation in bulimia, a few psychological events happen. So there's a dopamine release. Engaging in binge eating followed by compensatory behaviors like purging can temporarily increase dopamine levels. Dopamine is associated with the reward, pleasure, and satisfaction system. There's a positive reinforcement cycle. So the release of dopamine creates a temporary sense of relief or pleasure, reinforcing the disordered behavior. Over time, this can create a cycle of dependence on these actions to achieve the same chemical stimulation. Stress and cortisol. The act of binging and purging may initially reduce stress hormones like cortisol, but it can also exacerbate stress and anxiety in the long term. Addiction-like behaviors, the chemical response in the brain during these actions resembles mechanisms seen in addiction, where the individual continues the behavior despite negative consequences. The dopamine pathway, so the reward system. So what happens is when an individual engages in addictive behavior, like consuming drugs, alcohol, gambling, or overeating, the brain releases dopamine, a neurotransmitter that's associated with reward and pleasure. Why it feels good is this dopamine surge reinforces the behavior, creating a strong memory of the pleasurable experience. The brain essentially learns that the activity is rewarding and it seeks to repeat it. Why it hurts. When the behavior is stopped, dopamine levels drop dramatically, causing withdrawal symptoms like anxiety, irritability, depression, or physical discomfort. The relief-seeking loop. So the individual often returns to the behavior not just to feel pleasure, but to avoid the pain of withdrawal. Okay, so some fun facts about bulimia. Approximately 94% of those with bulimia never seek or delay treatment. While there are available treatments, some populations do not have access to treatment, and left untreated, bulimia can become severe and lead to other serious comorbidities. So the median age and onset of bulimia is 12 years old, and the onset could be as high as 18 to 44 years old with a lifetime lifetime prevalence of 1.5 among females and 0.5% among males. So these differences are unjust and preventable, and can occur between racial groups, social, economic status, or gender. So I might be a white female, you might be a black female, and it might be more likely that I become bulimic than you based on our social economical status, or vice versa, or same with genders, if it's male or female, that kind of thing. The primary diagnostic criterion for bulimia is stated in the Diagnostic and Statistical Manual of Mental Disorders, the 4th edition and the 5th edition. I know the DSM is a big deal in psychology, so for any of you that want to do some more research on bulimia, those 2 editions are available with lots of information. Fun facts on bulimia. The severity of bulimia is based upon the frequency of complementary behaviors and may reflect on other symptoms and functional disability, and are categorized based upon average episodes of compensatory behaviors per week. So these categories include mild being 1 to 3 times per week, moderate being 4 to 7 times per week, so that's pretty much once a day, severe being 8 to 13 times per week, and then of course extreme would be 14 times per week, so that's pretty much twice a day, so that's pretty much most of your food intake, if not all. So it's important to keep those things in mind. Okay, because I have a question for you and I want to know the answer, and I'd like to try to give me as much of a detailed response as possible. So you can leave it in the chat or keep it to yourself, whatever it might be. I'll give you a few minutes to kind of make a decision on how you feel about this situation. So a 20-year-old woman presents with fatigue. Laboratory tests reveal a serum potassium level of 2.3 millimole per liter and a serum bicarbonate level of 36 millimole per liter. She is 163 centimeters, which is 64 inches tall, and weighs 54 kilograms, which is 119 pounds. The findings on physical examination are normal. On questioning, she admits to binge eating and vomiting as frequently as 5 times per day. How should she be treated? Okay, so I want you to think about that question and then provide me with a detailed answer. So we're going to keep moving on, but yeah, let me know what you think. And we have the results on the next page. Okay, so the woman's condition is considered extreme. 5 times a day is a lot. It's pretty much all you'd be consuming. So you would ask her if she's interested in support and can offer trauma support, clinical counseling, CBT therapy, a hospital even, if necessary. Ask her if she feels burnt out in life or has thoughts of self-harm. Realize this is an empathetic situation and how long has this been going on. It could be something that she's been doing her whole life and knows a lot about and doesn't need to worry about going to a hospital for something going wrong. Or ask her if it's been a short amount of time, was there a change, a reason for a change, something like that. Offer medication as her condition is severe. Where it is severe, medication is available for people with bulimia at that level. She's a healthy weight, so ask if she's lost a lot of weight or has always been this size. Keep in mind that a lot of people who are bulimic are trying to lose weight or trying to keep from obesity. So you could ask her if she's lost weight in the past or if there's any reason that triggered her to become bulimic in the first place. Offer education around eating disorders. There's lots of educational material, especially available at hospitals or clinics, around education and eating disorders. So offer as much of that as you can so at least she could look over it on her own time and kind of decide what she wanted to do. And then is she alone in this, or does she have family or friends support? So a lot of people, again, with bulimia don't talk about it. They might not even talk about it to their friends and family. So it's important to ask them if they're alone in the situation so doctors can tell the difference and know who to trust when it comes to that information. All right, so treatments and help. Okay, so therapy is the number one treatment available, psychological treatment. So we have cognitive behavioral therapy, so CBT. It's the most effective therapy for bulimia, focuses on identifying and changing unhealthy thought patterns, addressing triggers for binging and purging, and developing healthy coping strategies. Dialectic behavioral therapy, DBT, so it's useful for individuals with emotional regulation difficulties. It teaches mindfulness, distress tolerance, and interpersonal effectiveness. And then we have family-based therapy, so FBT, which is particularly effective for adolescents. It involves the family in supporting the individual's recovery. Then we have nutritional counseling. So anyone with an applied human nutrition degree might be interested that you can be a registered dietitian and can help develop a structured meal plan to normalize eating patterns and reduce binge purge cycles. Education about nutrition and balanced diets can help improve the relationship with food. Medical monitoring, regular checkups are critical to address the physical effects of bulimia, such as electrolyte imbalances, esophageal damage, and heart issues. Medication, there's always medication available. It's antidepressants, SSRIs like fluoxetine, approved for bulimia treatment and can reduce binge purge episodes, often used alongside therapy to manage co-occurring anxiety or depression in general. And then, of course, there's support groups and peer support. So joining eating disorder support groups in person or online can provide immaculate support and reduce feelings of inadequacies. And groups like Eating Disorders Anonymous and National Eating Disorders offer valuable resources as well. Encouragement for recovery. Recovery is not linear and may involve setbacks, but the persistence and support individuals can achieve lasting change. It's important to seek help early and take small, manageable steps towards a healthier relationship with food and self-image. Searching for information. Search terms include phrases like bulimia nervosa treatment, bulimia nervosa in clinical trials, bulimia nervosa in randomized clinical trials, or bulimia nervosa diagnosis and treatment. Any studies that did not involve randomized controlled trials and treatment of bulimia nervosa were excluded. So to do some really deep digging online to find some really good responses, people tended to use forums to find easier access to bulimia information, where young people would call it anemia for anyone with anorexia or bulimia. And then what they would do is they would talk about their experiences online, and it was a really good way of me gathering research information because it's just basic things that people have experienced that would be really good to do trials on. Things like the types of foods they would eat, why they would eat them, because it was easier to purge, or yeah, different things like that. So it's kind of interesting when you're researching bulimia, having your own experience with bulimia, and then listening to other people's experiences and the similarities and the disparities between the two. It's really fascinating. Considerations in animals. Are animals like us? So while similar neurochemical processes exist in animals, their behaviors, example binge eating and vomiting, are often rooted in instinctual or medical conditions rather than intentional patterns influenced by the same neurological rewards humans experience. So what that means is cats are bulimic. It's just a funny I put in there. Cats may exhibit behaviors such as overeating, polyphagia, and regurgitation, which could be considered a form of cat bulimia. Cat bulimia. It's funny. All right, so that is all for our presentation today. I hope you enjoyed it. I hope you learned some really good information about bulimia and some of the ways to combat some of the issues and some beneficial gains, some of the good parts about bulimia, that why people do it in the first place. So thank you for watching my video. Here's a picture of me and my son. He's 8. And yeah, I just thought I'd throw a picture of us in there just so that we could get a shining moment while we're doing this presentation. All right, and there's some resources for those of you who are interested, and I can provide my PowerPoint slide if you need it. All right, thanks everyone. Enjoy the rest of your day, week, month, year, all of it, life. Okay, bye-bye.